Alright, so you've just had a spine surgery and you've gone home and now you're wondering what are the do's and what are the don'ts. Maybe you forgot to ask the doctors or maybe you've not understood it well. In this video, we are going to talk in detail about what are the do's and don'ts after having spine surgery. Welcome to my channel Zen Spine English. My name is Dr. Rakesh Dhake. I'm a consultant spine surgeon working in Mumbai. So when you go home after having spine surgery, first of all, take whatever medicines the doctor has told you to take. These would mean there might be some antibiotics to prevent you from having infection. This could be some medicines to control your pain. There might be some medicines for nerve-related pain, which could be pregabalin, gabapentin, and there might be some medicines to heal your wound. So in general, these medicines may last from 7 to 15 days. So please follow what your doctor has told you for taking the medicines. If your doctor has given you a brace to wear after spine surgery, like an LS belt or a cervical collar, then please do wear that collar for the specified period. Usually we give it for 6 to 8 weeks after surgery. But after that, whether you should continue or not will depend on the follow-up visit with your doctor. The next very important thing for you to follow after spine surgery is whatever exercises you or your physiotherapist have told you. It is very important that after surgery you please follow those exercises and you do it in the morning and evening. Whatever exercise causes you pain, you shouldn't do that exercise, but rest of the exercise, whatever they have told you, you should please do those exercises, because it is important that you strengthen your muscles around your spine, especially your core and your back. And if those muscles are strong, your spine will be supported and your pain will gradually come down. Another important thing after spine surgery is to maintain your posture. Make sure that you're sleeping straight, you're getting out of the bed in a proper way, you're not lifting any objects, and follow the precautions that your doctors have told you about how long you should sit, whether you should bend or not, and whether you should lift or not, or how heavy should you lift. Other important point to follow after surgery is to have a proper diet. What I mean by that is make sure that your diet is not junk food. It is more nutritious. Like you can have protein, calcium, fruits which are rich in antioxidants. So your diet should be a proper balanced diet and you should try and avoid junk food. Your diet should provide you adequate protein and calcium so that your wound is healing well. Now, talking about don'ts after spine surgery, the first and the foremost is if you are smoking, you have to stop the smoking before surgery and even after surgery, because smoking will very badly impact your spinal healing. And if you cannot stop smoking, it is better that you don't have spine surgery. So this is a discussion that should have happened before the surgery with your doctor. I especially do not encourage patients who are on smoking or tobacco to have spine surgery. I don't encourage them. It is better that you don't have that surgery. You first stop the smoking habit and then you can go ahead with surgery, because this will really affect your results after spine surgery. Other important thing is to make sure that you do not build your weight after surgery. You do not increase your weight, because a moderate weight is what we want, but too much of weight will put a lot of stress on your spine, because more the weight, more the work that spine has to do to keep you upright, and that will really result in stress on your spine and increase your back pain. So make sure that you don't get obese or overweight after having spine surgery. So make sure that your diet is in control, you stay fit, you do regular exercises, what has been advised, and you keep your weight in control. Next thing is that make sure that you bend if you have to bend in a proper way. Meaning your back should be straight and you should be bending your hips and knees and not arching your back. If you have to lift anything heavy from the floor, first consult your doctor how heavy can you lift. And moderate weight lifting should be okay after a few weeks, but then you should be keeping your back straight. If we say yes, we don't know how someone is going to bend or lift. Hence, doctor usually say that not to bend and not to lift. But if you maintain your back form in a proper way, then you can bend. But try and do that only after consulting your doctor, because every spine surgery might be of a different nature and we don't know what your doctor has done. So proper consult with your doctor before you bend or lift. Other important thing is, even if you have had a minor surgery like a discectomy, the rest of the discs in your spine are good. Now, to prevent them and the affected disc from worsening, you shouldn't sit for more than 45 minutes to 1 hour at a stretch. If you sit more than 45 minutes at a stretch, you are putting a lot of stress on your discs. So if I show you the numbers, when you're lying down, when you're flat, the gravity is not acting. So the pressure on the discs is 25 units. But when you sit, it can go as high to 185 units. Or 180 units. This amount of increase in pressure that you're putting on the discs constantly for hours and hours every day, especially in sitting jobs, this is what we want you to avoid. Break that cycle after every 45 minutes to 1 hour. Do what you're doing standing, or go to the toilet, have a sip of water and come back. So prolonged sitting should be avoided after spine surgery. Another thing to note is try and avoid using Indian toilet or squatting, because when you sit on Indian toilet for more than a few minutes, it puts a lot of stress on your back, especially when you get up. So it is advisable that you use commode or Western toilet where you are sitting, and also the height of that commode should be in such a way that you don't have to put a lot of stress or pressure to sit down. In such cases, you can also get a raise that you can put on the commode so that the height of the commode is adjusted. Another important thing to note is you might be feeling all right after spine surgery and you might be overexcited to go to work and get back to your routine. But you should do that only after you have a proper follow-up with your doctor and your doctor gives you a green signal. Please do not rush to work. If you go to work, we don't know what you're going to do there. So better have that discussion with your doctor first and only then resume your duties. And also driving and traveling, you should resume approximately after 3 months, but again, case to case, it might vary. So talk to your doctor, when should you travel and when should you drive. Another confusion is about having bath after spine surgery. Now, usually the wound has dressing. So sometimes the dressing is waterproof. In such cases, you can have bath. But if the edges of the dressing are not good, then there might be some water that may enter the wound. So have a discussion with your doctor whether you can have bath or not. I usually recommend that you can sit on the stool and wash front of your body and not wet your wound. So your dressing should not be soiled with water, stool and urine. So these things should not enter your wound. So try and maintain it dry. And if there is any soakage, please inform it to your doctor that there is a soakage, it might need changing. So yes, you can have shower after spine surgery, but try to keep that area dry. Sit down properly in the bathroom, and with a hand shower, you can wash the front of your body and you can just mop your back. So this was in short discussion about what you should do and what you shouldn't do after having spine surgery. But if you still have any doubts, please do not hesitate to write in the comment section below. We will try when we get time to get back to you and answer your comments. And also, if you find this video informative, please do not forget to like this video and subscribe the channel. It helps us reach people and spread spinal awareness. If you also have some doubts, you can WhatsApp us on the number given below and we'll try our best to get back to you when we get time. Thank you so much.